It's time for Doc and Friends, featuring Dr. Charette Chalfontenot, Irma P., and Amanda M.
Hey everybody, it's Dr. Charette Chalfontenot, and I'm sure we all know somebody or have a family member that's had a stroke. Stroke is the fifth leading cause of death in the U.S. Approximately 800,000 folk have a stroke every year. Of those, 140,000 die.
Every 4 seconds in the United States, someone dies from a stroke.
What is a stroke? A stroke is when there's decreased blood flow to an area of the brain. The blood flow means decreased oxygen to the brain. So this can be caused by a clot, which means it's an ischemic stroke, or from a bleed, which means a blood vessel bled and there's decreased pressure to that area of the brain, decreased blood flow, thus decreased oxygen. What are the risk factors for stroke? Uncontrolled blood pressures, diabetes, high cholesterol, aneurysms, arteriovenous malformation, sickle cell disease, smoking, obesity, the usual characters, right?
Also, atrial fibrillation is a risk factor. Residents of the southern portion of the United States, it seems south central and southeastern United States, are more likely to have a stroke.
When it comes to race, African Americans are 2 times more likely to have a stroke. And African American females are more likely than African American males to have a stroke.
Knowing the signs and symptoms of a stroke are crucial. It's important to act fast. It is important to recognize the facial drooping, the arm weakness, the slurred speech or difficulty speaking, and then it's time to call 911 immediately. 87% of strokes are ischemic, which means a clot has decreased blood flow to the area and decreased the oxygen to the area. 13% of strokes are hemorrhagic, which means there was a bleed that caused the decreased blood flow and decreased oxygen to the area. Brain cells do not regenerate. Here are images of ischemic strokes and hemorrhagic strokes. Some are CT scans of the brain, some are MRIs of the brain. Treatment for ischemic strokes involve removing the blood clot. That can be done via medication such as TPA or mechanically removing the clot. It is also paramount to decrease the blood pressure. Treatment for hemorrhagic strokes also include lowering the blood pressure and relieving the blood that has pooled in a certain area of the brain via craniotomy or via other techniques. I cannot emphasize enough the importance of acting fast. Get the patient to a stroke center as soon as possible. Do not delay.
So what can we do to decrease our risk of stroke? Lose weight, control our weight, keep our blood pressures controlled, keep our blood sugars controlled, drink less alcohol because alcohol can raise your blood pressure, keep your cholesterol under control. So, strokes. There are ischemic strokes and there are hemorrhagic strokes. Hemorrhagic strokes are also known as intracerebral hemorrhages, or ICH. The causes of those are aneurysms, arteriovenous malformations, which we call AVMs.
80% of strokes are preventable. The CDC has launched an initiative to decrease the number of strokes and heart attacks by 2022. Know your risk factors. Type the word "red" in the comments if any of this information was helpful.
Remember to
Like
share.
and subscribe.
John Savage all day.